So I've divided ascites into two parts of presentation. In part 1, we will be discussing about the definition, the etiology of ascites, pathophysiology, clinical features, clinical examination and grading. In part 2 of ascites presentation, I will be discussing about the diagnosis and the management of ascites. Okay. So what do you mean by ascites? Ascites is pathological accumulation of fluid within the peritoneal cavity. So the term pathological is very important. Okay. So normally we know peritoneal cavity has around some 25 to 50 ml of fluid to lubricate the tissues which line the abdominal wall and the viscera. So when this amount of fluid becomes pathologically increased, then we call it as ascites. And worldwide also the most common cause of ascites is cirrhosis and portal hypertension. Now briefly into the etiology or causes of ascites. So main 4 causes of ascites includes portal hypertension, hypoalbuminemia, reduced serum albumin, peritoneal diseases and other miscellaneous causes. So we'll discuss this one by one. First, portal hypertension. So what are the causes of portal hypertension? Briefly, we classify it as prehepatic, hepatic and post-hepatic causes. So this is the splenic vein and the superior mesenteric vein joining to form the portal vein. Okay, so before it enters the liver, the problem here is called as prehepatic causes. And so that includes portal vein thrombosis or splenic vein thrombosis or AV fistulas. And the hepatic causes, we know the portal vein drains into the liver sinusoids. So any problem in the sinusoids, as in case of cirrhosis or any other causes of fibrosis like primary biliary cirrhosis or sclerosing cholangitis can result in increased sinusoidal pressure and ascites. Okay, other causes include alcoholic hepatitis, schistosomiasis, polycystic liver diseases and veno-occlusive diseases of liver. So these are the hepatic causes. Now once from the sinusoids, venous blood is drained through the hepatic veins into the IVC, that is inferior vena cava, which drains into the right side of the heart. We know that. So post-hepatic causes include any problem in the hepatic venous outflow obstruction like Budd-Chiari syndrome or IVC thrombosis or right heart problem. So right heart dysfunction or constrictive pericarditis. So these includes the post-hepatic causes of portal hypertension. Okay, so to reinforce again, the prehepatic causes includes portal vein thrombosis, splenic vein thrombosis. Hepatic causes include cirrhosis, alcoholic hepatitis, hepatic veno-occlusive diseases, primary biliary cirrhosis, primary sclerosing cholangitis. And post-hepatic causes includes Budd-Chiari syndrome, which is hepatic venous outflow obstruction or inferior vena cava obstruction, right heart failure to be very specific or constrictive pericarditis. So here I would like to introduce another important concept like prehepatic. So that is portal hypertension usually causes ascites in the presence of a sinusoidal hypertension. So the hepatic sinusoidal pressure should be more to result in formation of ascites. Okay. So simple prehepatic cause alone like just an isolated portal vein thrombosis may not result in ascites because it doesn't increase the sinusoidal pressure. Okay, so usually it is along with cirrhosis, along with some other causes can result in ascites. For example, a patient with extrahepatic portal vein obstruction doesn't have ascites. The reason being the sinusoidal pressure should increase, the hepatic sinusoidal pressure should increase. So which increases the hydrostatic pressure resulting in exudation of fluid and ascites. Okay, so this concept is also very important. In hepatic and post-hepatic causes, automatically the sinusoidal pressure increases and you have ascites. Whereas in prehepatic causes, isolated prehepatic cause may not have ascites. So this also you have to understand. Now having discussed about portal hypertension, the other important causes include hypoalbuminemia. So reduced serum albumin results in decreased oncotic pressure or colloid osmotic pressure. So which is going to result in exudation of fluid and ascites. So what are the causes of hypoalbuminemia? It could be because of poor intake, a severe malnutrition or increased loss either through the gut as in case of protein losing enteropathies, or through kidneys as in case of nephrotic syndrome. So these includes causes for hypoalbuminemia.